So I just want to start out really quickly. We continue to see a significant decline in the number of total cases coming out of that horrible stretch through the holidays. We peaked at a little bit over 450 cases a week. This week that just ended, we were down to about 200 cases in the county. We'll see what the Super Bowl brings. I do have concerns that people were getting together in ways that they shouldn't have in terms of passing infection along. So we will watch carefully over these next 2 weeks. The hospital is still having a large number of COVID cases. In the ICU, they are full. 7 of the 10 people admitted into the intensive care unit have COVID. We are not seeing as many cases on the general wards of the hospital at this point. 3 weeks ago, there were close to 30 people admitted on the general wards with COVID diagnosis. Presently, there are 9 people, so at least there's a decrease there. And you can see from age distributions that we've seen decreases across the board. Maybe most importantly, at the lowest end of the spectrum, we've seen less cases among children, with schools getting back this week. Hopefully the weather will cooperate a little bit and they won't have to cancel the last 2 days of the week. But it was very good for lots of reasons to see a significant decrease among the children and younger adolescents. And then turning to vaccinations. So I had mentioned last week that we had gone a little bit incrementally with the Pfizer vaccines. It was the first time we had dealt with those because of the added complexity with the different dosing and storage. So we had held a few, so our numbers were a little bit lower last week as far as percentage given, and kind of made the promise that we would make up for it this past week, which we did. So I know there's a lot of stuff up on that graph. Calvert has the 4th highest rate of vaccination. Now, it may seem confusing to people that you can somehow give out more than 100% of the vaccines that you have gotten. The reason for that is that the Pfizer vaccines, typically you can get out 1 extra dose per vial. So that when you factor that in, if you're able to extract a little bit extra, then it by the way the state is accounting for things, pushes up above 100%. But regardless, you can see that for the vast majority of local health departments, that they have distributed or administered over 95% of the vaccines that we have received. And then taking a look at the percentage of the residents of each county that have been vaccinated, Calvert has the 4th highest percentage. The only counties that have more than us have received a disproportionately high number of vaccines per capita. So you may be aware that the distribution by the state to each county has not been equal. And some counties have gotten twice as many vaccines per capita as others. Calvert's been kind of the mid to lower part of that range, so just a little bit under median. So we are doing, I think, a good job in aggregate in the county getting these vaccines out, even though we have not received a higher than average number of vaccines into the county. And that's a combination of effort, not only for the staff at the hospital, the staff at the health department, flashing back a few years, but also the hospital staff that's working with us and the county staff. I know that Jennifer Moreland and Susan Justice at Office on Aging have been tremendous help getting especially seniors registered in. I think that's all my slides, yeah. So happy to answer questions if there are any.
So, Dr. Polsky, are we through phase 1A yet?
Yes. With the extra pause I gave was because it's not as simple as, has everyone who is a first responder, everyone who works in a doctor's office been vaccinated? We know that the majority in each of those categories were, but not everyone decided to get vaccinated. And every week we have a few more people who decide, they're an EMT or they work in a doctor's office, and they finally decide at this point they're comfortable, they want to go ahead and get vaccinated. So every week we have additional 1A people that we are vaccinating. And 1B will be the same way, that when we do get through all the 1B, there will be people that we have to blend back in.
So 1A is 75 and older, correct?
Oh, I'm sorry. So the 75 and older, we have not finished. I'm sorry. I was thinking all the professionals that are prioritized by the governor. About a week and a half ago, I thought we were going to finish through. Two things happened that we have not finished. One is that we saw another wave of people register over that next week. So we had more than 1,000 additional people come onto the registry that we had not originally accounted for. And the other, as I know you all are aware, our allocations have been cut back significantly. So we were getting 2,000 doses a week, and now this week we're down to 500 doses. So at the rate things are, even if we're devoting every dose that we get to people 75 and over, it's going to take us about a month to finish all of the people 75 and over.
So, Doc, a couple questions. Say somebody has COVID, they get over it. Do they go get the shot?
So the CDC currently is recommending that for everyone who has had COVID, there's documentation they were tested, they still should be vaccinated. The reasoning there is that the antibody response from the vaccine seems to be better than when people just get a natural infection. So the concern by the national experts is that for people who had the infection, their immunity will start to weaken over time and they'll be susceptible to being reinfected. So the recommendation is to boost up with the vaccine. Now, currently, the CDC is recommending for people to get both of their doses. There is a study going on right now to take a look for people who have already been infected. Do they only need one additional dose? We don't know at this point because those studies are still ongoing.
That was kind of leading into my other question is, with the struggle to get everybody covered, do you say, well, I got to make sure if I don't do the second shot, the first one was worthless? I mean, you know what I mean?
Yeah.
So,
well, and we know that there is some protection for the Pfizer Moderna, but it's not complete, and it's when they get that second dose that you boost up. But what they did not study in the initial, as they did the trials for both those vaccines, were people who already had been infected, and to see what they would need. So that's why, again, those studies are ongoing right now. It may turn out we may have new recommendations over the upcoming months to modify things for people who were previously infected, but as of this moment, recommendations are still those people should receive vaccination and they should get both of the doses.
because you're going to struggle getting a second shot out, don't you think?
Well, in which
With
respect?
the way
you
the
mean?
doses are coming out, I mean, at this rate, you're going to struggle. You're going to get to a point where you've given out so many first dosages.
Yeah.
Say you've done 5,000 people.
Yeah.
Isn't there a time period here to get that second one in, or does
So
it expire?
It does complicate things with the 2-dose regimen. So as this week we are, so we got 500 first-time doses. So we'll be vaccinating those people, and we have about 2,000 people getting their second doses that we have to vaccinate as well. So it does complicate things when we have two.
And it's the
pools of
same
people.
shot, right?
Correct.
It's the same one you got before. You're just getting the same one again. You're just boosting it up.
Correct.
So yeah, that's what I think you're going to struggle. Because I know you're going to try to get everybody on the list, but as you're going through it now, somebody's going to go, "Hey, well, I'm ready for my second one."
To keep in mind that once the person gets their second dose, then they are now moved completely off.
Sure.
So you have out of every 4-week period, you have people who are coming in for their first dose. They'll come back the next 4 weeks for their second. And that second time, you have people coming in for their first. 4 weeks later, those first people. So you continue.
How do you juggle that?
Well, but the second dose people continue to move off the assembly line, so to speak.
Sure, sure.
And so every week, as things go, you have a certain number of first dose and a certain number of second dose. And it's just the first dose then shifted the following week's second dose, and you blend in new first dose people.
Do you
So you're
prioritize
always
the
taking
second
people
one?
out of things after they get their second dose.
Do you
We
prioritize the second one so that you get them off the system and say this person is completely done, or do you try to get as many
No,
first shots you can?
So we've been doing this for a few weeks now with second doses. We work our times. We try actually to have just second dose people coming in certain times and just first dose, but world's not that simple. But we've been able to manage. So we've been doing this for several weeks now, and we've been doing okay. The concern right now is not so much how to balance that first and second dose. It's that our first doses are being cut away, and we have less and less ability to vaccinate people in this county. And the way the state is shifting things is that people will need to go out of county to these mass vaccination sites to get their vaccines. Right now, as the state's set up at Six Flags, which is a bit of a haul for people, and of course they're fighting for those doses with everybody who lives in Montgomery County
Sure.
and Prince George's County and everywhere else. The state is looking to have a site in Southern Maryland, but the site they're looking at is in Charles County, where the minor league baseball team plays. If you live in Lusby or Solomons, it's still an hour and a half round trip, assuming there's no traffic or anything. So it's for older people, or people who don't have easy access to transportation. It's going to be extremely difficult. And again, they are battling for spots with everyone in the entire region. There's no way to make sure that people in Calvert County get prioritized for those vaccines.
Doctor, when they get to that point of, if they get to that point of having the stadium there at White Plains in place, County Administrator, we're going to need transportation, public transportation facilities to be able to move people over there that don't have transportation. So that needs to be a factor when they start talking about that.
Well, and
to
it's
be
going to
able
be
to
complicated because you may be talking just 2 or 3 people in an hour. And
We've got to provide public transportation if that's the way they're going to operate. That's a factor
I
we
agree.
have to do.
It's just it's
Yeah.
not going to be as
Yeah, it
simple
won't be easy.
as because at the moment there's no systemization to this. So it's not like if let's say that over the day there are 15 people from Calvert who managed to get appointments, they're not all going to be condensed into a narrow time window. They're going to be randomly scattered.
Understood that. Yeah.
So in order to be able to get those people over in some reasonable way is going to be a real challenge.
Well,
and-
that's a challenge we'll have to take on when it gets here, but we need to prep for it. So
I
some way
agree.
of consolidating those numbers, but people that don't have transportation are not going to be left behind for a shot reason.
And we have continued to ask, not when I say we, all of the health officers around the state have continued to ask for projections out for weeks to come so we know what we'll have locally, and still nothing forthcoming. So for this week, I didn't find out until midday on Saturday what we were getting for this week. So planning continues to be really impossible.
Yeah, don't envy that.
The only other thing I want to mention is with the call for inclement weather, this week we've already started getting calls about people wanting to reschedule. We've decided that we're going to cancel our Thursday appointments and shift those people to next Tuesday. So we're already starting the process. We'll coordinate with the county, with communications to get word out, and we will shift over. And then Friday, for the moment, we're going to leave in place. We're going to wait probably until sometime late into tomorrow to see how the forecast continues to shape up. And if need be, then we will open up on the holiday on Monday and do vaccinations there, shift those people. The state is not making this easy on us in lots of respects. One of the problems is the computer system that we are forced to use to schedule people does not shift appointments. So for people who are scheduled for Thursday, we can't just shift their appointment to Tuesday. We have to cancel their appointment. They need to completely re-register for an appointment on Tuesday, which, yeah. And just every step of this process has been
A
much
challenge.
more work.
We got a
and
lot of different
challenge.
hands in the pot, which
Well, just basics. I mean, this is technology, and I go back a few years now. Shifting people in medical systems when they cancel an appointment, which happens all the time in private practice. Somebody can't make it in for one reason or another, or if I had to go for an emergency surgery and I needed to shift patients, all we would do is click a couple buttons and then move them. But this system, even in 2021, can't seem to do that. And so all those people that we had to hand register because they didn't have internet access, we're going to have to go back. And even for those that do, they're going to have to go through the whole registration process again because the system can't shift their appointment times. So there probably will be, I'm just giving you some heads up, there probably will be some problems with this. But we also realize that canceling the last minute, if we do end up getting the snow that they're calling for, it would also be a real mess. So we're trying to do it in a more orderly fashion by anticipating by a couple
Good.
days. All right.
So I guess part of the takeaway that I want the citizens to hear is, we get all these complaints, is that we have not completed 1A. So if you're over 75, you have to be patient. We're trying to work through that, but we have not finished phase 1A. The other is that the state's allocating these doses based on population. We get compared to St. Mary's in most of our complaints. And St. Mary's has 113,000 people. We only have 92,000. So St. Mary's is getting twice as many doses as we are. Even though there's only 20,000 more people, they're getting twice as many doses as we are based on the basic allocation. And if you look at the distribution chart, Calvert and St. Mary's are getting all their vaccinations out. So we're not holding back. The system is working. The one compliment that we do get is the people that do go to our site at the industrial park say it's a wonderful system. It works great. They're very happy once they get into that system. So we have every Thursday we have a statewide call on COVID with the governor's office. We've been complaining for weeks about the issues that the state's creating for us. And, we understand there's a limited amount of dosages, but the state has not helped ease this process by opening up all these contractors and mass vaccination centers. It's just created an extra complication for us. Yesterday, we had a town hall meeting with U.S. Senator Van Hollen. We all raised the issue with him. Not that it's his problem, but just want to make sure that everybody hears the issues that the counties are facing based on this distribution system. So I just beg all of you to be patient. We're doing the best we can. There's a limited amount of doses, and we're trying to work through the list as quickly as possible. But it's going to take time. If you look at the doses we're getting, 500 a week, there's 30,000 people on the registry. It's going to take time until we get more approved, that we get more supply in the chain. So you just
Right.
have to be patient.
And that, as much as I hate to say it, we've started encouraging everyone to go anywhere and everywhere to get their vaccines. And it compounds the problem that although the state is shifting also to pharmacies, currently there's only one pharmacy in our entire county that's receiving any vaccine, and they're receiving, I think last week they got 250 doses. So again, and that pharmacy up in Dunkirk is right where people from Anne Arundel and Prince George's have more access than most of our residents. And there's no restrictions on who can go to that pharmacy. So most of those doses are likely going to people outside of Calvert.
I know of a couple in Southern Anne Arundel had to go to the Maryland Live Casino to get their shots. So
Right. So and there is no unified registration system. So for people who aren't, we can't get to them with our very, very limited numbers of doses. They're going to need to register at each pharmacy. There's a separate registry for CVS versus Giant versus Walmart versus Rite Aid, Safeway. And then if they want to register at the mass vaccination sites, separate registry as well.
thank you, Dr. Polsky.
All right.
Appreciate
Thank you all.
Thanks, Doc.